Welcome. Thank you very much for joining us. You're watching This Is My Health. And we are in the series where we are looking at infectious diseases. Many of the things we talked about have to do with HIV and AIDS. But remember, HIV is an infectious disease, and therefore we do talk about a number of other infectious diseases. Again, HIV is a sexually transmitted infection, so we do get into topics of reproductive health. Today we want to look at a very broad topic, infectious diseases that cause cancer. And I have a very special friend today joining me, a doctor who actually specializes in infectious diseases. Welcome, Doc.
Hello.
Hey, please, have a seat.
Thank you.
Thank you very much for coming to join me at this cafe. Would you like to have something?
Yes, please.
And that would be?
I would like to have some lemon water, strawberry, and some grapes.
Okay. Thank you very much. I believe that will be coming. As they are bringing the order, I've just told our audience that you are a specialist in infectious diseases, nothing more than that. Would you like to introduce yourself, please?
Yes, my name is Dr. Kili Kurusa. Yes, I am an internal medicine physician, then subspecialized in infectious diseases. Thank you.
Okay. Yeah, so you are the right person to help us unpack this. The topic for today is we want to look at infectious diseases that cause cancer. We like to define words because, doctors, you fly above the heads when it comes to some of these words. Let's start with the define what is cancer, and then you can go on to what are infectious diseases. Once we have those two, maybe we can then go into the meat of the discussion.
Yes, maybe before I get into the definition of cancer, let me just state that God created us in a perfect way.
Oh, okay.
And we have got what is called cells in our body, which are supposed to grow and multiply in an orderly fashion. So those cells in the body, when they lose that orderly fashion and they multiply out of proportion, they then spread to other parts of the body, and that's what we call cancer.
Okay, so cancer basically would be the cells misbehaving.
Yes, that's right.
It's a very simplistic way.
Yes.
Okay, and what are infectious diseases?
Infectious diseases, it's a group of different conditions which are caused by small particles which we call infections. They can be bacteria, they can be viruses, fungus, or parasites. So diseases which are caused by those microorganisms are called infectious diseases.
No, thank you very much for that. Now, we have got infections on one side. We have got cells misbehaving on the other side. How do they meet? Which of these make crossover to the other side? I'm imagining an infection. You should get cured on that, but it looks like they can cross to the other side. Talk to us about that.
Yes, that's right. And that is very important because oftentimes we take certain infections light. We don't want them treated because maybe they are having minimal symptoms or little symptoms. But infections, certain infections in particular, when they have been in the body for a long time, those that we call chronic infections, they can cause a lot of inflammation in our body. And by so doing, they stimulate those cells to start misbehaving and cause cancer.
So the infection itself would be the one that stimulates or triggers this uncontrollable inflammation that you talked about, that then the cells can, okay. So, for example, what are some of those? You say we take some lightly, like what? Yes,
it's a couple of them, but perhaps we'll just mention a few, especially those which are very common.
Yes.
They are mostly viruses, but they are also bacteria and parasites that can do that.
Yes.
The viruses, for example, the commonest ones will be hepatitis B virus.
And that is the one for the liver?
It causes the inflammation in the liver.
In the liver, because hepatitis means something for the liver, right?
Yes, inflammation of the liver.
Yes.
So there is hepatitis B and hepatitis C.
Okay.
Both viruses, they can cause what we call a chronic infection. Chronic infection simply means an infection which has been there for a long time.
And how are they spread? This hepatitis B and hepatitis C. How does somebody get it?
Yes, you can get them through blood contamination, blood products. For example, people who are having needle pricks. Needle pricks can happen in the setting of healthcare workers, trying to assist their patients, and then they get
So the patient, if the patient has the virus,
they transmit
then it
it.
transmits to the other person.
Yes.
And which other people then?
And then people who uses drugs, illegal substances which are injectable.
Injectable drugs,
if they
yes.
share those needles,
Yes.
they can actually transmit the viruses. Or they do tattoos on themselves.
Oh, even tattoos.
Yes,
So,
if they are using the piercing objects that they are using, if they are not sterilized or not cleaned adequately, one who has got the virus, they can transmit it to the next person.
So I'm imagining that in an African setting, sometimes we have traditional doctors who also do piercings and the like, and there is not always that sterilization. Can that also happen?
Absolutely, absolutely. That can do. As long as one person has got the virus, that can be transmitted to the next person who don't have. Yes.
Can they also be sexually transmitted or something? Because, well, we are talking HIV and other things that are sexually transmitted conditions. So I always poke that area.
Yes, actually there are multiple causes. So sexual transmission is one of them, particularly when we talk about hepatitis B.
Okay.
Hepatitis C doesn't get transmitted sexually.
Okay,
Yes.
hepatitis B does.
Hepatitis B does. So a partner who is who's hepatitis B positive, they can transmit the infection to their partner who is hepatitis B negative, and they are not protected.
Yeah. I like that you talk about that, because the talks with the HIV and things have made it such that when people are talking condoms, it's almost always just thinking HIV or thinking some small sexually transmitted disease that can be dealt with easily. But you are talking about something very serious, that you can get liver cancer from what I'm hearing.
Absolutely.
Yes.
The other mode of transmission, it could be from a mother who has the infection, transmitting it to their unborn child.
This is a serious condition.
Yes. So both of them, the hepatitis B and hepatitis C,
yes.
they can be transmitted in that mode. Okay. So these are very important modes, so that we should know and understand what's the best way to prevent them.
Okay. Now that was hepatitis B and C. Another condition?
Yes, another one is what we call human papilloma virus.
By the way, you are welcome to have your
Oh, yes,
there.
yes. Let me have a sip of my water.
Okay, yes. Yeah.
I'm very passionate about these topics.
I can see that.
So when I talk, I forget to eat.
Yes.
Yes. Human papilloma virus. That's most commonly people will say HPV. That's the abbreviation for the names that are described on this virus.
Does it have a common thing that people see? That do they call it HPV, or they say a common street name or something?
Not necessarily, although for us, people in the health field, there are certain things that we can pick on people like warts. And then we know that this is associated with that virus. Yes.
So people who have got warts are those that we can be thinking.
Yes, along those lines. Yes. So human papilloma virus, like hepatitis B, it's also acquired sexually. Yes, but you can also acquire it when you are in contact, like through saliva, with people who do have the virus. But they are different.
Can it be in the mouth then? When you say saliva and people who have the virus, I'm trying to put that together.
It will be in the saliva, yes. Yes, it will be in the saliva.
Okay. Yeah.
And then this virus, it has got different types. So there are certain types which don't cause cancer. And there are those which are high risk and they cause cancer. Yes. Like when we talk about type 16 and type 18, those are in the class of those that can cause cancer.
So what type of cancer will they cause?
Yes, they cause almost all of the cervical cancer that we see. Majority of them are associated. Cancer. Yes, cervical cancer, but you can also see anal cancer. With this hepatitis, penile cancer, you can have
HPV,
HPV, yes, HPV.
Okay. You have another one?
Yes, let me maybe cross over to the bacteria, but we have not exhausted the
We have not
viruses.
exhausted virus,
Yes.
but we are talking about the common ones.
Yes, I'm
Don't
talking
worry,
about the
we'll come to a
common
point where we
ones.
start talking about the prevention and the like. For now, I just want to get a feel
An
of what is there.
Yes. You know, there's this bacteria which is found in our stomach called Helicobacter pylori. Yes, this bacteria can actually cause stomach ulcers.
Okay, so people who don't know all those strange long words, usually they'll be having the ulcers or issues around ulcers. That's how you know they might be having the bacteria.
Yes, oftentimes they'll complain of heartburn, discomfort in the stomach, and when tests are done, that bacteria can be detected. So this bacteria, if it goes untreated, it can actually cause stomach ulcer, and it can cause actually the type which is called lymphoma in the stomach.
So it can cause cancer.
It can cause cancer if it's not treated.
So in other words, if somebody has got ulcers, they really have to get them treated and get the bacteria out of the body.
Yes, first of all, they have to be tested to find if those ulcers are caused by this bacteria.
Yes.
Then they get treated, because you can get ulcers from other causes.
From other causes. That's another discussion for another day.
Yes, and then I mentioned that there are some certain parasites. Yes, there are certain parasites which are called flatworms or fluke, but the medical name will be schistosoma.
That's a very, very big name.
Yes.
Okay, so they're flukes.
Yes, they are flukes. Yes, let's stay with flukes. Yes.
Yes.
So this parasite is found in some fresh water in certain parts in Africa. Yes. And when people swim in this water, which are contaminated with these flatworms or these flukes, they can get infected from these flukes, and they can actually cause bladder cancer. And one of the signs they will see with that, they will urinate blood. Yes.
Okay.
So that's one
So
other
this
type.
business of swimming in just water that's standing there can also lead to some serious problems.
It carries some risks. Yes,
Yes.
it carries some risks. Yes.
So our time now is up. So what we are going to do is go for a short break. When we come back, we'll unpack those ones. And I don't know if you want to throw in a few more, but we can look at the prevention of at least the few you have talked about. I know this is a whole afternoon discussion, but we have just a few minutes here.
Absolutely. Yes.
Please don't go away. We'll be right back. Welcome back. If you're just joining us now, you're watching This Is My Health. And today we are looking at infections or infectious diseases that have association with or can actually cause cancer. In the studio, I've got Dr. Kelly Kuruza. Welcome back, Doc.
Thank you, ma'am.
Yes. Before we went, we had managed to unpack a few viruses, bacteria, and some parasites that are associated with cancer. And then when we're just going off, you were talking about schistosomiasis or the fluke that you called with such a big name. And now, the next, do you have another one that causes that?
Yes. I spoke that, I mentioned that the viruses, there are a number of them. I would like to go back to the viruses. I gave you some highlight on one bacteria and the parasite.
One bacteria, one parasite, and the like, yes.
And I would like to perhaps touch a bit on virus, not directly as a virus that causes the cancer, but to highlight that the HIV virus itself, through its effect on our immune system, you know, it can lower the immune system and make us to be at a high risk for viruses that can actually cause cancer. Yes. An example of that will be a virus which we call Kaposi sarcoma virus, or in medical terms, they will say herpes human virus 8. So this virus causes cancer of the skin. Yes, most people who their immunity is low, they are at a high risk of getting this cancer.
Does everybody in general commonly have the herpes virus around? Is it something that's commonly found?
Absolutely.
Yes.
The virus is there. When we are tested, we could be found to have the virus.
But it doesn't-
But then it takes advantage of the HIV virus, lowering the immunity.
Yeah. So that sounds like it's a common thing with HIV. That is not so much that is bringing stuff in, but stuff lives with us around. And then, as you say, when the immunity goes down, then all these things start to take advantage of what is going on around.
Yes.
Okay.
So that virus does take care of the advantage of the immunity, which will mean if you take care of the immunity, you are
Preventing
preventing this
cancer.
type of the cancer. Yes,
Yes.
because the virus itself is there.
So this Kaposi, where in the body? Because all the others you've been telling us, okay, this one will be the cancer in the liver, this is cancer in the stomach, cancer in the bladder. Where is this Kaposi?
Yes, it's cancer of the skin.
Okay.
And as you know, the skin is the biggest organ in our
the
body.
body,
So
yes.
anyway, it can be anywhere. Commonly, people will find them in their limbs, like in the legs, but it can pretty much be everywhere. If it's not treated, that's when it will go to other organs. Yes. Mm. And then there's another virus also which takes advantage of low immunity, which happens in the setting of HIV. It's called EBV. That's the abbreviation for it, but the medical term is Epstein-Barr virus.
Sounds like somebody's name.
Yes, most of these are
named
named
by
after
after people,
people. Yes.
Yes.
So this virus causes cancer of the glands or the lymph nodes. So when the immunity is low, this cancer makes our cells to misbehave and then cause inflammation on the glands, and they can cause this cancer. So these two are particularly cancers which, if you find, you start worrying whether there's HIV on the background
So sometimes what can present is the cancer.
first before you know the
You know that,
diagnosis.
okay. Yes, now let's talk about the prevention. Perhaps since you talked so much about the viruses, let's talk about the prevention maybe from the viruses side. How can we prevent this? Because I think preventing this is preventing cancer.
Absolutely.
And cancer is a problem.
Yes, absolutely. Yes. Prevention pretty much depends on some of them on the mode of transmission. How are they transmitted? And then that's where the prevention will come from. But before we go into those ones, I want to mention the ones that, in addition to preventing by the way they are transmitted, there are certain vaccines for some of them. Yes.
Yes, that's a good one.
Hepatitis B in particular, there is a vaccine that one can get, and that will help them to prevent them from getting the liver cancer or getting the hepatitis B infection, which eventually causes liver cancer. And I think this is one of the greatest things in infectious disease, to have vaccines which indirectly actually prevent cancer.
Yes, I like that because we know that the story on vaccines has got pros and cons. Different people have got different ideas over what should or should not happen with the vaccines. But I like that when you're talking about cancer, because we are saying in adhering to the vaccines, you may actually help yourself from a very, very big problem like that. So I think that's a very good one to bring up. Yes.
Yes, and with the hepatitis B vaccine, those who were born after 1980 in most countries, they routinely get vaccinated. So children, when they are getting these postnatal vaccinations, the hepatitis B vaccines
So
are
the baby
in them.
clinic is very important.
It is very important that our children get vaccinated because we do give them hepatitis B vaccine, which eventually helps them not to get hepatitis B infection and not to be at risk of this liver cancer from hepatitis B. Yes.
Another one with vaccine?
Before I go to that one, let me mention that for those who didn't get vaccinated or were
When they were
born
young,
before
yes.
1980, we do recommend that they should get vaccinated. Yes, we strongly recommend that they should get vaccinated so that they can benefit from prevention. Unfortunately, hepatitis C doesn't have a vaccine. Yes.
No.
Human papillomavirus does have a vaccine.
Yes.
Yes, this vaccine is recommended for people who are aged 9 years to 26 years. But there's also what we call catch-up vaccination program, which can be done when you are older.
Is that the one where people are supposed to vaccinate before they become sexually active?
Yes, well, I think the idea of 9 to 26 was to try and target that.
Okay.
Yes.
Because I remember one time when I was told that at school, our kids were being vaccinated for something against cervical cancer. I was like, wait just a minute. They are just kids. They are not even sexually. They say, yeah, you've got to catch them before they get in there. What's the logic with that?
Yes, this virus is transmitted sexually, like I mentioned. That's the big part. So the idea is to try and prevent getting the virus and getting the vaccine so that when the virus comes, you're already protected. It will be there, but it won't be infecting you to eventually cause the problem on your body.
So we are actually preventing cervical cancer.
We are actually preventing cervical cancer by vaccinating.
Good news. I'm hoping that people will take advantage. But now, if you are 35, can you still go for the vaccine? Because you said up to 26. Can you still do that?
There's that catch-up vaccine, which means after that age, you can get vaccinated. You get tested. If you don't have those high-risk viruses which are high risk for causing the cancer, then you can get vaccinated so that should you get in contact with those, you won't be infected. Yes. So those are the two which have vaccines. Unfortunately, the others, they don't have. So the mode of prevention would be more on us. Be more proactive with our lifestyle, the way we do things. For example, I mentioned that hepatitis C can be transmitted through piercing, sharing needles. Some of the things that we use, like in drugs, if you avoid those kind of habits where you are going to be sharing needles and having to use
hopefully
drugs.
Start by avoiding the drugs first, yeah?
Yes, because the moment you start,
it becomes tricky.
I mean, the moment you start using drugs, it may be drugs that are not injectable, but then eventually you'll get there.
What I was saying becomes tricky is it's difficult to find money for the drugs and money for the injection. So it becomes tricky to get some other things. Okay, now, believe it or not, our time has run out. You have just about 2 minutes there if you want to run through some treatment or any last words.
Yes. Then we spoke about the Helicobacter, which causes the stomach cancer. That one, there's treatment with the antibiotics and antacid that one can get. The course is only 2 weeks, so you get treated and you are preventing. And then for the one with the fluke or the parasite, you can get also antiparasitic medications or medications against the parasite, which will help you to prevent
clear that and prevent the bladder cancer.
Get into the bladder cancer, But the most important thing is knowing that these infections do exist and knowing that we take the right precautions. 2 of these I mentioned sexual transmission. So we have to be very careful with our sexual practices, the way we do them, and how it's posing a risk to us, like we talked about early sexual interaction, which increases the risk of getting that cervical cancer. With the human papillomavirus, there's also a screening test called a pap smear, which you can do, and you can be able to pick from that to see if you are at risk for getting the cancer before you actually have it.
How regularly would it be recommended for one to do the screening?
Yes, there are different classes that we recommend for. For example, people who are living with HIV, just because of that concept of the immunity going down, they are recommended to have the pap smear every year, at least once a year. But for people who do not have the virus, they can have the pap smear every 2 to 3 years, as long as that one is negative. Clean, But if it's abnormal, depending on what it showed, your provider may say 6 months, repeat the pap smear.
Any last words?
Yes. Our health is very important and we have to take charge of it. When we find things which we don't understand about our body, we have to take action. Especially when it comes to cancer, they are best when dealt with early. But the most important one is to prevent.
Yes, prevention. Thank you very much for stopping by, Doc. I'm sure to invite you again because I like the depth of knowledge you have.
Thank you.
There you have it, folks. It's been a pleasure having the good doctor here, all of us are scared of cancer, me included. Now, isn't it good news to find out that there is a possibility of preventing some cancer? It is said that knowledge is power. Many of us who may not be medically trained may be wondering where this cancer thing is coming from. Cancer is not just cancer. There are different types of cancer out there, and as you have heard today, there are those that can come through because the body was triggered by some infection. And you and I have got control over those infections. Let's start with the first things that we can actually do. When there are vaccines out there, the responsible thing is for us to go and get vaccinated, because a vaccine puts us one step ahead in terms of the prevention. Secondly, our lifestyles. When we talk about sexually transmitted infections, starting by abstinence and staying aversion when you are not married, and when you are married, being faithful and staying with that one partner, all these things can actually prevent you from getting cancer. Cervical cancer is known that is driven by a virus. There are so many things that we can discuss, but at the end of the day, discussions don't do much for us if we don't do action. So, my parting word for you today is, this is your health. It is up to you to do the responsible thing. What you have heard, you go and practice and make sure that you can save yourself and your family in the process. Keep watching all our series. Until next time, God bless.